Chronic inflammation is increasingly recognized as a central driver of aging, so much so that scientists have coined the term inflammaging to describe the persistent, low-grade inflammation that characterizes the aging process. Unlike the acute inflammation that helps heal wounds or fight infections, this chronic form is subtle, systemic, and often silent, until it contributes to diseases like heart disease, Alzheimer's, type 2 diabetes, and cancer. One of its most damaging effects is on the aging of cells themselves, including the shortening of telomeres, the protective DNA caps that keep chromosomes stable. In this context, vitamin D has emerged as a nutrient of particular interest for its apparent ability to suppress inflammatory signaling and potentially slow down this biological wear and tear. The link between inflammation and cellular aging begins with immune system overactivity. As we age, immune cells often become dysregulated and begin releasing inflammatory cytokines even in the absence of threats. These signaling molecules, such as interleukin-6, IL-6, tumor necrosis factor alpha, TNF-A, and C-reactive protein, CRP, drive chronic inflammation that damages tissues and accelerates the senescence of cells. Senescent cells, in turn, release more inflammatory signals, creating a self-perpetuating cycle of deterioration. Over time, this process erodes telomeres and impairs the body's ability to regenerate and repair, leading to visible signs of aging and increased vulnerability to age-related disease. Vitamin D plays a counterbalancing role in this process. Known primarily for regulating calcium metabolism and supporting bone health, vitamin D also functions as a modulator of the immune system. Its active form, calcitriol, binds to vitamin D receptors on immune cells, influencing their behavior in ways that tend to reduce inflammation. Specifically, vitamin D can suppress the activity of pro-inflammatory T helper 1, Th1, and Th17 cells while promoting more regulatory immune responses that reduce immune overactivation. It also inhibits the production of inflammatory cytokines like IL-6 and TNF-A, both of which are closely associated with accelerated biological aging. Clinical studies have consistently shown that individuals with low vitamin D levels have higher markers of systemic inflammation. Conversely, raising vitamin D levels, especially into the range of 30 to 50 nanograms per milliliter, often correlates with reduced CRP and other inflammatory biomarkers. In aging populations, these changes can be meaningful. Lower inflammation means reduced cellular stress, slower telomere erosion, and improved resilience against chronic diseases. While not a cure-all, vitamin D appears to lower the temperature on the body's constant simmer of immune activation. Mechanistically, vitamin D may also impact gene expression pathways involved in oxidative stress, mitochondrial function, and autophagy, all of which are influenced by inflammation and contribute to cellular aging. By improving mitochondrial efficiency and reducing reactive oxygen species, vitamin D helps prevent DNA damage and maintain genomic integrity. These effects are especially relevant in tissues like the brain, blood vessels, and immune organs, where inflammation-driven aging manifests most acutely. Importantly, vitamin D deficiency becomes more common with age due to factors like reduced sun exposure, diminished skin synthesis, and impaired kidney function. As a result, many older adults may suffer from a subtle but chronic lack of vitamin D, which can leave inflammatory pathways unchecked. Supplementation, often at doses of 1,000 to 2,000 IU daily, has been shown to safely restore adequate levels and can be a low-cost, low-risk intervention to help moderate age-related inflammation. In summary, inflammation is not just a symptom of aging but a powerful accelerator of it, damaging tissues, shortening telomeres, and reducing physiological function over time. Vitamin D offers a natural and effective way to tone down this chronic inflammatory signaling. Through its immune-modulating effects, antioxidant support, and influence on gene expression, vitamin D may slow the march of biological aging, making it a valuable tool in maintaining health and resilience across the lifespan.